Hello, welcome to RAAONLINE. I'm Dr. Raaonline. Today, let's discuss goiter. What is a goiter? Any diffuse enlargement of the thyroid gland is called a goiter. So, it's a very general term. It's an amalgamation of different disease entity presenting as a single symptom of enlargement of goiter. Often, patient presents with the thyroid swelling, and that is called a goiter. Now, how do we approach a topic on goiter? First, classify the goiter. How do we classify goiters? Diffuse smooth enlargement of the thyroid gland. Where does it happen? It happens in endemic goiter, where there is iodine deficiency leading to hypothyroid, leading to increased TSH, which increases thyroid gland size. Dishormonogenesis and congenital abnormality in defective thyroid secretion leading to similar situation of increased TSH, increased stimulation of thyroid gland and goiter appearance. Goitrogens, coming to physiological goiter. During the development, there are periods of increased demand for thyroid. Classically happens during the growth spurt at adolescent age. When there is an increased demand, if the gland is not able to secrete increased amount of thyroxine, TSH will increase the size of the gland, hoping to compensate for the decreased function. There is an entity called colloid goiter, where there is a persistent increase in the size of the physiological goiter, and the regression time, some of the follicles coalesce to form cyst containing colloid, and you call it colloid goiter. Classical inflammatory thyroid disease like Hashimoto's or thyroiditis, which can be subacute, like Goitre's disease, which happens after any viral infection. Very rarely acute bacterial infection of the thyroid. Third thyroid inflammatory disease is Riedel's disease, which is fibrosed thyroid gland. Another cause for diffuse smooth enlargement is drug-induced amiodarone, interferon alpha, lithium ingestion. All this can increase the size of the thyroid gland because of reduced thyroid output. Now, second one is a nodular enlargement of thyroid gland. This is a diffuse enlargement with multiple nodules appearing on the thyroid. This is classically called multinodular goiter, which is a very common disease. Diffuse goiter with some bosselated appearance, it happens in inflammatory thyroid disease. Another entity of goiter we have to remember is retrosternal goiter. This retrosternal goiter is the thyroid gland which is behind the manubrium sternum, and any increase in the size of this gland can cause pressure on the superior vena cava with attendant complications. Now, another way of classifying goiter is euthyroid goiter or hyperthyroid goiter. Euthyroid goiter, where the thyroid functions are normal, it is a smooth enlargement, as classically happens in physiological goiter in puberty or pregnancy when there is an increased demand. In the mid stages of autoimmune thyroid disease, where there was a phase of hyperthyroidism, then it comes to euthyroid, then it comes to hypothyroid. So, in the mid stage, you can have a increased thyroid gland with euthyroid state. Drug-induced goiters, colloid goiter, as you said, the thyroid function is normal, but there is a diffuse enlargement of the thyroid gland, and it is smooth. Now, when you have an increased thyroid status or hyperthyroid status with smooth enlargement of thyroid gland, that classically happens in Graves' disease. Here is a diffuse smooth enlarged thyroid gland with classical features of hyperthyroidism. Early stages of autoimmune diseases can also present as diffuse smooth enlarged thyroid gland with hyperthyroid features.